That's how important
I
TV
mean,
is.
when is it the right time to judge? What is judging? And why do people throw this term around?
Elevate TV, advancing kingdom lifestyle.
Good evening, guys. Welcome back to Health Up, this weekly show where we are all about health and wellness. And we are here to empower you and to enlighten you about certain conditions. And today we are going to be highlighting on hypertension. Again, we look at prevention and management of hypertension. This is one of the non-communicable diseases that has been on the rise because of the rise of the middle class. And again, the middle class is associated with rising in sedentary living. And so we want to just touch on it. How can we prevent ourselves from getting it? How can we protect our loved ones? And what can we do even if we are found to have the condition? So how do we manage it? So on the show today, I'm still joined with Sami and Onesmus, and I am Dr. Sylvia Mwathi. I'm a pediatrician by profession, and we're going to take you through this. So kindly watch the show. So let's start with Sami. Kindly introduce yourself.
Thank you, Dr. Sylvia. I'm Samuel Mwangi. I'm a clinician trained in emergency critical care medicine. You're welcome.
Welcome.
Thomas Mogo. I'm also a clinician and also trained in areas of public health. Currently in practice, private enterprise or private facility, the Oak Medical Center in Thika. Welcome.
Thank you. So welcome to the show. It's always glad to have you. You guys really know a lot, and we want you to enable the audience to have this information so that they can change their lifestyle. So let's just start with the definition of hypertension so that those who are out there can understand what it means.
Thank you, Doc. Hypertension, as you said, it's a non-communicable disease, which is a growing burden in especially our country. And not only our country, the whole Africa and global levels. It's a disease that the burden is progressively worsening. This is consistently elevated blood pressures in simple terms. Normally, our blood in the system moves with a certain pressure that is normally in normal range, the optimum for normal body function.
Yes.
But when persistently we record high levels above the normal blood pressure, that is when we call it hypertension or elevated blood pressures. Just to mention numbers, probably they may make sense or not to the audience.
Yeah.
The blood pressures that we are talking about elevated is above 140/90. When you have recorded such several times, you could be hypertensive.
Yes.
Yes.
So you said about persistent elevated high blood pressure.
Yes.
So does that mean, can someone just have one reading of, and they're told, you know, you have hypertension?
Great. This has some factors that we consider when taking blood pressures. Probably because it determines by one, the pump mechanism of the heart. The heart acts as the pump, and the vessels, the blood vessels, is the pathway.
Yes.
And then the blood is the passenger. It's the factors that relate to that really determine whether it's a true reading or a false reading. For example, when you're involved in physical activity, like we are running, we are jogging all over, we are lifting weight, our heart really pumps fast.
Yes.
Just to meet the physiological demand of the body.
Yes.
At that moment, when you take the blood pressure reading of a normal person, it will be very high.
Very high.
And it will be an isolated reading, which is incorrect. So when we're talking of consistently elevated blood pressure, this is when the patient is at rest.
At rest.
And there are no environmental factors related to the reading.
Yes.
Yes.
Yes, they are very true. So what are the causes of high blood pressure?
Right. Thank you, Daktari, for this. This is a very engaging show, and over time, I think it's creating out of awareness, and we are happy and glad about this.
Yeah.
And thank you for keeping on, hosting us.
Yes.
Blood pressure, for it to be elevated, there are several causes, or there are several things that could come into play. Picking it up from where Daktari just left, we are saying it has to be persistent, it has to be recorded over a number of times,
Yes.
and therefore we are saying one reading is not enough.
It's not
There has
enough.
to be some consistency in it. So in terms of causation, or what brings out this, maybe we can look at it in an easier way when we talk about classification, because again, hypertension is classified, into several groups.
Yes.
And probably for the purpose of this show, we'll not get into very deep details, but we'll say one would have what we call primary hypertension,
Yes.
or in other words, we call it essential hypertension. There is also what we call secondary. Every time there's primary, then there's something coming up, which is secondary hypertension. And of course, we have special, forms whereby we talk about in pregnant women. We talk about preeclampsia and the like. So those are special
Groups of
and
people.
forms of hypertension.
Yes.
But you're saying hypertension can either be primary, which is essential, or secondary. Now, primary hypertension is whereby we have consistently an elevated blood pressure in an individual, and in this case, we're actually talking of an adult.
Yeah.
This is over 18 years of age.
Yes.
So they have been elevated, and it actually constitutes of about 95% of the cases of the hypertension that we find actually essential. Now, the cause, largely, the causes are actually unknown. They have no specific explanations or reasons why it does happen. We only have some bit of probably risk factors
Yes.
that could risk into this. One is age.
Yeah.
The more one grows older, the higher the risk. By the time you are getting to 60 years of age, the risk actually doubles, of getting hypertension. So the risk goes on high. The race, some races are more exposed more than others. We're also talking
I
about
think they say Africans higher than the Caucasians.
exactly.
Yes.
Africans are higher than the Caucasians, and even the data in Africa compared even to the West, you'll find that the data in Africa is actually high. Obesity, the comparison of the weight and the height of a person, the body
Yes.
mass index. So obesity comes in as a risk factor to cause primary hypertension. Abuse of substance, like tobacco, cigarette smoking,
Yeah.
alcohol, or all these causes.
Most of them are stimulants. Yeah.
Yes, they are stimulants to, they cause the blood vessels to thin, and therefore that will cause to have a high pressure to flow through the vessel. You have, like he said, the passenger is having a difficult time, passing through the way and the route. So this will cause the blood pressure to be elevated. Of course, other factors like low vitamin D and the like. Now, when you talk of secondary hypertension,
Yes.
what you mean is, and this actually forms a small percentage, about 5%. But the good thing, if I say good, in that language, is that when you are able to come up with the cause, then you treat the cause, there's a likelihood that you can actually, manage
it.
the hypertension very well.
Or even cure it.
Or even cure it, because we are saying that secondary hypertension is when the hypertension is actually a symptom of a disease. So there are other diseases that can cause this. One, chronic kidney diseases can actually be one of the issue. Chronic heart disease can result from hypertension or can be a causation. So once you are able to manage that, then you're good to go.
And that's important because even for children,
Yes.
most of the time people wonder why children get hypertension.
Yes.
And children don't get the primary hypertension. They get the secondary
They got the secondary hypertension.
So most of the time they'll have issues with their kidneys where they can either have the chronic kidney disease or they can have what we call the glomerulonephritis.
True.
Yeah, so when they have these conditions, then it makes because the kidney is very important in the control of the blood pressure.
Absolutely.
Yeah, so they end up having the secondary forms of hypertension. Or if they have a problem with the aorta, which is the large heart that takes the blood out of the heart. If there's something called coarctation, the narrowing, then the pressures will be very elevated once the problem has been sorted out.
Yes.
Yeah.
Absolutely. Thank you for that input. Children are basically your heartbeat. So
Yes.
yeah, we understand. Thank
Yes,
you
they
for the input.
Yeah.
And probably just to also add, something we call sleep apnea or loss of sleep. Someone has not also been able to get enough sleep.
Yes.
Has also been documented as a factor that actually causes the blood pressure to be elevated.
Yes.
So our viewers, these are some of the things that we can also actually pick them up and know that they're also serious health problems, and we can be able to address them, or we can be able to have a health provider address them. Let me give a comment on we are still in the in the season, we call it so, of COVID-19, and a lot of co-current diseases or comorbidities or associated diseases have also been associated with this disease.
Yes.
And hypertension has not been left behind, so to say, because as much as studies have also been ongoing and also been done, there is some evidence that really hypertension has a linkage, with COVID-19.
Yes.
And one of the issues that has been brought up is because hypertension or elevated blood pressure persistently over a period of time affects the immune system.
Yes.
And once there is dysregulation or improper regulation of the immune system, then the viral disease, in this case the COVID, is able to take or to set up very well, quote unquote, for lack of a better word, and develop into a severe disease. So hypertension has also been linked to severe forms of COVID-19.
Yes.
So we are also saying that as much as we have been having this particular disease, hypertension, and we also have COVID, there's some linkage in the two. And the other factor will also be in terms of its management and how that influences that, and probably we'll get that as we move along the show.
Yeah. So maybe, Sammy, you had mentioned that the high blood pressure is when you have the pressure above 140/90. So are there any ranges or stages of this hypertension that maybe we would want to educate our viewers about?
Sure.
Yeah,
thank you. As that's a range.
Yes.
And there are usually stages towards hypertension. The normal range or average is usually 120 80.
Yes.
That is the normal range. And above that, that is 120 to 130, and from 80 to 90. Then that is usually called prehypertensive state, or impending hypertension.
Yes.
Then when you hit 140 there, you have now hypertension confirmed.
Yeah. So what would you advise somebody whose pressure is now ranging between 120, 139 there?
Exactly.
80 and 89.
This
90,
is a definition moment. At that moment is a definition moment.
Yes.
Whether you want to tip over to hypertension or to turn around things.
Yes.
This is an area that calls for dedication, personal discipline, and determination, and taking responsibility of somebody's health.
Yes.
Because once hypertension sets in, we say there's a chronic disease. To not only take medication to control it, and adjustment of lifestyle at that point.
Yes.
But before that, you can adjust your lifestyle earlier, and probably end up with better controlled blood pressure and lesser complications of the same.
Yes.
Yeah, of this adjustment of lifestyle in that calls for change of diet.
Yes.
Also being physically involved in activity.
Yes.
Avoiding sedentary kind of life.
Yes.
As we just said earlier on.
Yeah.
Yes.
And I think on the diet issue, maybe you could touch about it, because last week we looked at diabetes.
Yes.
And we saw that excessive of sugar and excessive of junk. But for hypertension, what seems to stand out more is the sodium.
Absolutely.
Yes. So maybe it would be important to touch on that.
Yes. Sodium now comes to salt intake.
Yes.
And it's directly associated with hypertension in the diet, especially when we take the added salt. Also above a certain level, that's 3 grams per day, 30 grams per day.
Actually,
for
I think 5 grams.
5
grams for the adult is what is recommended.
Okay.
Yes.
Above that, then it's excessive.
Yes.
And that is now what comes to making someone become more risky towards developing high blood pressure.
Yes.
So it's usually advisable for the viewers to know that you should not, or you should avoid taking excessive sodium, especially the added salt we do on food stuff. And sometimes people just lick salt because they feel
you see people who even add salt before they even taste the food.
Yes. that is a problem which we really need to understand. Yes.
Okay. Yeah, so we've seen this is an uncommunicable disease, and being in the public health, I think these are some of the things that really touch your heart when I see you talk about non-communicable diseases. So if you could tell us the burden of the disease globally or even locally, what are the numbers that we have here in Kenya?
All right. Thank you, Daktari. Looking at the numbers and looking at the burden of disease is very important, because that's why we engage the community and the society and every one of us.
Yes.
Because like we have always said, well, it's all known, prevention is better than cure.
Yes.
So how can we be able to prevent the disease other than just aiming to cure the disease? So that's why we always have to look at and think about what is the burden of this particular health problem. Now, having said, before even we go to that, maybe I would mention something about the non-communicable bit, because maybe our viewers, you're wondering what disease that we're calling non-communicable disease.
Yes.
We actually have two, we can classify, major diseases in two ways, amongst other ways or amongst other forms. One is what you call communicable disease,
yes,
or non-communicable diseases. Yes. And non-communicable diseases mean these are non-contagious, non-infectious disease, as opposed to the communicable disease. And the best example to give in terms of communicable disease is actually COVID-19. And that's why we have the measures that it's an infectious disease. We have the measures that we have. So we mean hypertension, is actually an uncommunicable disease. Now, globally, when you look at the problem, it looks like, and it is actually true from statistics, that Africa, as compared to the West, Africa has a bigger burden of the disease, more than the West. And some of the factors or some of the reasons which you could think about, we earlier on talked about race, and nowadays, Africans have also changed. So the issues about lifestyle, the way we live, lifestyle modification, and the way we are living is different from the way we used to live before. Urbanization and rural issues. Yes, all these are factors, all these are issues. So actually, in Africa, the prevalences are higher as compared to to the West. When we look at Kenya particularly, because the data in Kenya, I think that's most important, where most of our viewers would relate with. The current prevalence of hypertension is actually between 20 to 25% in most of the studies. Some of them have replaced that 24%. And when we say the prevalence, what we mean is the number of people, if you are to just go to the population and get all the adults over 18 years and get the number of people that are suffering from this particular disease at one particular point versus, the total population at that particular point, that's the percentage that we are getting. So, which is quite a significant number when you talk about 24%.
So now, in other words, it means 1 in every 4 adults. If you count 1, 2, 3, 4,
exactly,
there's one there who
has hypertension. Now, interestingly, Daktari, the other fact is about 56%, which is actually more than half of our population, are not even aware of their status. So those ones that we're actually counting 1 in every 4, they're actually not aware. The issue of awareness is another question. This is another question. So when you say that 56% are also not aware that they actually have the particular problem, out of that, the other thing that comes as part of the burden is the more we grow older, over above 60 years of age, the risk continues to increase, actually doubling and increasing as one is growing older and older. So in other words, it's coming with age. It's something which you cannot stop. I mean, as one advances in age, there is a definite rise. It's going to be a steady rise. It's going to be a small rise in normal circumstances, but at some point you're going to realize that some of that, or a big part of that population, is going to be diagnosed with hypertension. Now, the other interesting fact is, out of these that we are actually diagnosing with hypertension in the health facilities, and we won't follow them up, few of them are actually keen about follow-up and actually compliant about follow-up. A very small percentage, about 14%, is going to be keen about follow-up. And out of that, the rest are actually not keen. You started them on treatment, on medication, they are lost to follow-up. They're out there in the community, and it's a bit sad because the disease is progressing and it's causing effects and complications in the body, as we're going to talk about later. It's only a very small percentage, about 4.6% or 4%, that actually have well-controlled hypertension out of all those that is going to diagnose. So this is, when you look at this, and look at all these numbers that you're talking about, it tells us how many patients are going to develop hypertension, or individuals are going to develop hypertension, how many are going to die out of complications,
Yes.
and what is going to be the impact in the society in terms of the cost of living once these people are out there and they have complications, others have died, and all this has happened. So this is the burden in terms of the disease is actually very high.
Yeah.
And maybe we'll talk about this as we will be, in the course of the show, but
Yeah.
in terms of screening, in terms of looking at the disease, in terms of one being having the blood pressure taken, and how often this should be done. But the burden is really tangible. But our emphasis is, and our aim is, how can we be able to reduce this?
Yeah.
Yes.
Hypertension is known as one of those silent killers,
Exactly.
which you've mentioned.
Yes.
And you say that not many people know their condition. So maybe to bring this question to Sami, because people are walking, and we're not saying they are a time bomb waiting to happen, but are there any symptoms that would make somebody know that they have hypertension, or what would you advise people? Yeah.
Dr. That is a very serious problem we have in
Yeah.
our society, because the tendency we have in Kenya is we go to the hospital when we are aching, when we have pain, when we are really in a problem.
Yeah.
But walking into a hospital for a medical checkup is not our habit. It's not our, our thing to take every time now and then. And now hypertension now being a problem that will not come with pain or kind of obvious symptom.
Yeah.
Then as Dr. was saying, that's why we have a huge number of patients who we don't know, and they don't know their patients. Now, when it is severe, when hypertension goes to a certain level, it now starts manifesting through certain symptoms.
Yes.
And that is when it is taking toll on our organs. It can present with dizziness,
Yeah.
headache,
Yeah.
nosebleeds, blurry vision, palpitations,
Yeah.
and also muscle aches.
But this is when it's very high.
That is when
Very high.
it's really
Like
high.
180, 120.
Absolutely.
Yeah.
And actually, most of them is classified to a certain level of emergencies,
Yes.
intensive emergencies,
Yes.
test emergencies,
Yes.
and all that. So it's usually advisable, especially when someone feels like has stayed for some time without
Yeah.
at least a medical checkup. Just walk into a clinic nearby, a well-up clinic, and have your blood pressure taken, and you could prevent a lot of other problems.
Yeah.
Yes.
That's maybe one of the reasons why blood pressure is one of those vital signs that are always taken.
Absolutely.
Whenever anybody goes to hospital,
Yes.
temperature will be taken, pulse rate will be taken, and
Yes.
their blood pressure, because many people don't even know that they have it.
As you say, Doc.
Yeah. So that's very important. So maybe you could just tell us, we said you cannot just take one blood pressure and say this person has high blood pressure, hypertension. So how many, or what is the duration of time between maybe the different measurements that could be taken, so that you can now tell someone for real, this is the condition that you have?
Right.
Yeah.
Thank you. The issue about taking the blood pressure and how to diagnose, because I believe that's it, how to come up with a conclusion that someone has hypertension and they're not just elevated blood pressure here and there.
Yeah.
We have several ways in which you actually take this blood pressure. One, we have what we call ambulatory blood pressure measurement, whereby an individual will have a machine sort of placed, the simple ones like a watch on the wrist, and then they're going to have that blood pressure, that machine taking their blood pressure over 24-hour period of a couple of days, and they're just taking the readings, and that means they are doing up their activities, they are walking, like we say, up and down, doing what they must do, doing their daily activities, and you also have a reading in that. So that's one way. And the reason why this ambulatory blood pressure is also important, you take it over a period of time, 1 day and beyond, is because sometimes some people have an office blood pressure that is normal. But then when they begin sort of activity, then the blood pressure rises up to levels that are actually worrisome or that requires attention.
Yes.
So that's why we come up, or that's why there is an issue of ambulatory blood pressure measurement. The other measurement that is also done is now the contemporary, what you have is office blood pressure measurement.
Yeah.
and I like it, the way we are putting it, is one of the important signs.
Yeah.
And every patient that is in a health facility,
Yes.
it's recommended, and it's actually to be the case that they must have their blood pressure, taken.
Yes.
So we have the patient come, they relax for about 3 to 5 minutes,
Yes.
because some of them may have walked up the stairs, others may be anxious, others maybe have rain to come,
And the
different.
one they call white coat hypertension.
Yes, so we need
Where they see the doctor in the blood pressure
exactly
rises.
exactly. So we need these patients to relax, rest,
Yeah.
then we take their measurement
Yes.
and be able to say that then this is your blood pressure. But now, all the same, even at that particular point, even if the blood pressure, like we say the upper reading, which you call the systolic, or the lower reading, which you call the diastolic, like the child said, it's more than 140/90. We also need to have at least 3 separate,
Yes.
readings
Yes.
for this blood pressure to be really called hypertension, or to be labeled that someone is really hypertensive.
Yes.
So one reading is not enough, because again we could have other intervening factors that could be causing this blood pressure to be really up. And because again we also have to consider which one is up. Is it the systolic or diastolic? And some of them are affected by different things, although both of them are important in terms of the diagnosis. So the office blood pressure, and of course there is the hypertension that you also need to the elevated blood pressure that you also need to be careful about, what you just mentioned about white coat hypertension, which will be able to be sorted out once we have by the ambulatory blood pressures, because there's some people who just appear in the hospital,
Yes.
and for whatever reason they fear the white coat, and I think that's why
some
Daktari is
people
always
avoid
associated
the
with a white
office.
coat. Yes.
Yes.
So when they just see the doctor, or they think everything, some of them just smell the medicine or whatever is going on,
Yeah.
and their pressure just goes up.
Yes.
So that's why we need to have several occasions of readings. We need to have ambulatory blood pressures,
Yes.
and we need to make this diagnosis as accurate as possible. And the reason is, the moment, especially we talk about someone being hypertensive,
Yes.
especially primary hypertension,
Yes.
we are going to control this blood pressure for life.
For life.
It's not an issue of removing a certain bacteria, certain virus in somebody's body. We need the pressure, so we are not eradicating the pressure once again. We
That's
want
why
the
we are
pressure to be
saying this
controlled.
time
Yes.
when they have the pre-hypertension, when they
Yes.
are between 139, 140, they start taking care of themselves.
Taking care of
and
themselves,
they modify their
and they
lifestyle.
modify their lifestyle.
Yeah.
So
yeah.
so that when we make the diagnosis, it's we are not going to we are not going to return.
Yes.
So by the time you're saying these are going to be your medicine, we need to be very confident, even as the
Yeah.
health providers, so we don't make false diagnoses, or we don't just overdiagnose people,
Yeah.
or sometimes lose the cases. So that's why the reason of really being keen with the blood pressures. Yeah.
Okay. Yeah, so I think maybe the main thing we're saying is that, especially if people are like at around 40 years old, they should have a routine checkup, at least an annual checkup, because at that age, we've seen as you grow older, the chance of somebody developing hypertension then also rises. So I see we have at least a minute to go. Maybe we could just mention a few things about how we would treat a patient with with hypertension.
Thank you. For treatment of hypertension,
Yeah.
It's two-way.
Yes.
Actually, it involves both medication and lifestyle modification.
Yes.
For medication, literally will be a prescription from the doctor,
Yes.
who advises the patient what to do and how to take the medication.
Yes.
These medications, it's good to mention that someone has to stay with medications for a long time and probably lifetime.
Yes.
What happens with medication is, with time, doctor will review your medication, would change them, would add, would subtract this medication, depending on the need of the time and how control you need of your blood pressure.
Okay, so we think we can hold that thought and we'll take it up from there.
Thank you.
So to our viewers, we are talking about how to treat the hypertension, and they're saying you need to take care of what you've been given by the doctor, and you need to adhere to the advice that you've been given. So we're going to go on break, and when we come back, we'll continue from there. Keep watching.
Each one of us, many times, we may not have been hearing this voice.
Maybe help us shed some light on how does God speak to me concerning the assignment He has placed upon my life.
This person, because of trying to be who is not, becomes an usher.
Yeah.
the way they will handle you, you will not want to come to church again. And you can then begin demonstrating the source of your wisdom and say, I prayed and God revealed this to me.
Tea is overrated.
Lord, how?
Tea, unapiga na mukate ama unapiga na nduma ama unanina ngwashe, then you're good to go.
Let's say on Monday you do your cassava porridge.
Yeah?
Kenyans together. That's how important
I
tea
mean,
is.
when is it the right time to judge? What is judging? And why do people throw this term around?
Welcome back, viewers. So we were talking about hypertension just before we left for the break, and now we were talking about the treatment of this condition. So Mr. Sami was explaining to us how we can treat and manage the hypertension. So we'll continue from there. Mr. Sami, take over.
Thank you, Dr. As you were saying earlier, that management to hypertension, it's bidirectional, and these two directions go hand in hand at one point, especially when hypertension is confirmed.
Yeah.
This means that both medication and lifestyle modification has to go hand in hand. For the medication use, as I said, that it's purely under prescription of the physician who will provide the drugs to the patient who has been diagnosed with hypertension.
Yes.
And it's good to mention that these drugs are lifelong medications. And these are drugs to be adhered to, otherwise they will not achieve the intended purpose, that is to achieve the control of the pressure, blood pressure. Amongst the drugs that are used in control of blood pressure include the drugs that act on the heart, and they slow the kind of heart rate to prevent the blood pressure from rising. That is primarily from the heart rate.
Yes.
And the other category acts on the vessels, because we know when vessels are contracted, the blood tends to pass through the vessels with a high pressure, leading to hypertension. And so the drug acts at that point, and it helps relieve the blood pressure. And many other categories, including others acting centrally, others acting through the kidney mechanisms and systems, and so on and so forth. And many of these drugs are oral, they are tablets, and they are friendly to the patient, so they can take the medications. And only that, there are different categories of medications that the drug doctor can prescribe.
Yes.
He could prescribe one type of drug to one patient, and probably 2 or 3 types to a different patient, depending on the goal of the control that they want to achieve. It's usually advisable that the patient really adheres to the medication. The other part of it is the lifestyle modification. This goes hand in hand. Because things don't remain the same again. We're dealing with controlling of a disease that is a chronic disease. So it's essential to understand and also to rise up for to the occasion. Lifestyle modification, as probably mentioned earlier, it involves determination, personal discipline, and taking responsibility of somebody's health, because it improves the outcome of treatment and also achieving the goals earlier. And you may find someone who takes real responsibility of lifestyle modification, having his drugs reduced and probably reviewed downwards by the physician. Because on the other hand, he is playing his part in managing of the condition. Things that involve lifestyle modification includes one, diet. Dietary check includes activity, physical activity involvement. includes and also probably literature, that is reading and understanding of the condition, and responding to what you get. That is the advice that is given to you. So amongst other things, these are the key areas that really involve management of the disease of hypertension.
Yeah, that's important. And as you've mentioned, the doctor can either be escalating the medications in a stepwise fashion, or the doctor can actually be reducing them.
Absolutely.
Yeah, so if somebody is to make sure that they're looking at the lifestyle modification, they can actually find themselves maybe only on one tablet.
Sure.
Yeah, for the rest of their lives.
Yeah.
So, are we saying that somebody who has hypertension can live a healthy life? Yeah.
Right. Good question. Is it a license, or is it, a done case that once you're diagnosed or someone is diagnosed with hypertension, that things are forever doomed, thereafter?
Yeah.
No. What we are basically saying is these are the disease whereby we can achieve optimal control.
True.
And this optimal control that can be achieved through, medicine, or what you call pharmacological ways and non-pharmacological ways, or, supportive therapy or adjunct therapy. We are saying when this is actually done, we can actually achieve, and someone can actually lead a normal life. It's only that you need to be careful that the blood pressure is well controlled, so that we don't get into problems in terms of complications.
What are some of the complications that can arise from high blood pressure, and what are the ways to mitigate, development of these complications?
Right. Thank you very much. What we are saying is, once someone is diagnosed with hypertension, we need to be objective in terms of our approach. And one of the main objective in terms of managing this hypertension is to make sure that the blood pressure is controlled within normal levels, optimal for the body organs to work within.
So it can even go low.
Exactly. We don't want to over medicate, because once we over medicate or over treat in that sense, then that means we're going to be reducing the blood pressure too low, whereby the body is not able to achieve its functions. So one of the major objectives is to make sure that the blood pressures, or blood pressure rather, it's within the normal range. Number two objective is to make sure that we minimize or we reduce or prevent occurrence of complication as much as possible, because we don't want complications happening. Some of them are very serious and could be fatal. So complications do arise. Now, having said that, before we even go in to details about these complications, there are some other severe forms of hypertension that we also don't want the patient to develop, whereby the blood pressure goes way too high, like readings of 180, the upper one, and readings of 120, the lower one, which you call the diastolic, because these high readings can actually be fatal, and they're actually referred to as hypertensive emergencies. We also don't want,
especially when involved with the end organ damage.
Exactly, when there is end organ damage, and there are symptoms, and patient will just come with symptoms that are telling you something is happening and is wrong, or hypertensive urgency. So these are things that are very acute and quite fatal, and you don't want patients to develop with this. Now, having said that, other complications can also come in or be in the picture, which are a bit more slowly in terms of development and in terms of us being able to identify the symptoms. Interesting, hypertension, like we began by saying, it's largely asymptomatic. It's largely without any symptom. When the symptoms begin to set in, some organ is beginning to be damaged. And at that point, complications have started arising from this particular disease. So some of the things that we pray to see in hypertensive patients, there are complications, could damage many organs, but of major importance, especially the brain. And of course, we know that the brain is such a very serious and a very great organ in that sense to the body. So it could actually damage the brain. And in what sense? It's because once these pressures are too high, and we have blood vessels, the small capillaries and the small blood vessels that are supplying the brain cells, and the pressures are too high, they could actually burst. And when they burst, they just bleed, on the brain cells, and the brain is not able to, access, whatever the blood was carrying, the nutrients, the oxygen, so the brain cells begins to die off, because there is no access to what the cells need, and therefore when the brain cells begins to die off, issues to do with stroke,
Yeah.
you know, what you call cerebrovascular accident begins to happen. You realize that an individual is beginning to have weakness of a particular part of the body, be the right side or the left side, you know, or there's the muscles of the face are beginning to have, you know,
deviation
that
onto one
deviation,
side,
yes,
yeah.
onto one side.
Yeah.
So it could cause a stroke.
Yes.
Other
And
issues.
the worst thing is that it's long term.
The worst thing is that is basically long term.
Yeah.
Even when we begin to manage the effects of the stroke,
Yeah.
we really want to see, can the patient or can the individual do with what is remaining,
Yes.
and how can they cope with their situation. So that's quite serious.
I think I'd ask Sami maybe to highlight another complication, because I know
Absolutely.
there are quite many.
Sure,
Absolutely.
yeah,
Yeah.
quite a number.
Yeah.
Doc just mentioned about the stroke.
Yeah.
It's a problem. And we also have cardiovascular problems, such as angina. Angina comes when the blood pressure is too high and the heart is pumping, itself is pumping, and it's not getting adequate oxygen supply for its function.
Yes.
And the patient presents with kind of a chest pain,
Yes.
which is dull and kind of constricting at the electrosternal space.
That's
at the
behind
chest.
here,
Yes,
this
behind
bone.
here. Yes. And that in itself makes patient very uncomfortable and very uneasy and anxious. It can complicate. It can progress from angina probably to also myocardial infarction to a one point when the vessel is occluded.
And that's what we commonly know as heart attack.
Yes, heart attack.
Yes.
When there is no supply of oxygen, that is blood, to a certain part of the heart muscle, we
And I
end
think
up.
we have the.
Oh yeah.
You can use this
Actually.
if you want to show people, because these are some of the blood vessels we have to the heart. Yeah.
Absolutely. Yeah. This is now the heart muscles.
Yes.
This most likely will be the ventricles, the lower part of it, and these are the atriums. We're talking about these vessels in blue.
Yes.
They are veins.
The veins, yeah.
And the one in red,
Are the
they
arteries.
are arteries. When we have an occlusion at the artery level, and the artery literally supplies the muscles of the heart with the blood, which literally supplies oxygen. When there is an occlusion, then a certain part of the heart muscle does not have adequate oxygenation.
Yeah.
And you know, that is in literal understanding is like when you can tie your finger tightly with a string or a tight ring or something, and just wait. You know how uncomfortable it becomes. Blue, it turns blue,
Gray.
you know, and it can end up being
Gangrene.
destroyed, gangrene and destroyed.
Yeah.
So the same happening to the heart,
Yes.
which is the pump of the blood that we essentially need. So it's one of the complications. Another thing still in the cardiovascular system is because of the high pressures, the rhythm of the heart is affected. The heart usually beats at a certain rate per minute,
Yes.
averagely 70 to 80. And because with a regular rhythm, usually called sinus rhythm,
Yes.
when we have a high blood pressures,
Yes.
most likely in CVS, there could be a complication called arrhythmias. This arrhythmias is when the rhythm of the heart is distorted from a normal sinus rhythm to funny rhythms, because the body is trying to compensate itself.
Or sometimes even where you have the sinoatrial node, or where you have those nodes,
Yes.
the area has already died because
Exactly.
they didn't get enough nutrition.
oxygen.
Yeah.
Yes. You find that at the other parts of the heart trying to repress it.
Yes.
And we end up with a very distorted rhythm.
Yes.
And you know, the number one killer of CVS issues is arrhythmias.
Yes.
Actually, it has a high number of incidents of mortality. Many
Yes.
people have the incident of mortality from arrhythmias than many other conditions from CVS. So these are just a few things in the CVS.
Yeah.
And we also have a complication that may come now from the heart to the vessels, now to the organ.
The entire volume of blood flows through the kidney 36 times. And that tells you when you have a problem or a challenge, in terms of the blood pressure,
Yes.
what will be the impact or what will be the implication that is going to be happening in the kidneys?
Yes.
That tells you that if you have a problem with the blood pressure and the kidneys are there, then there is a direct damage, there is a direct linkage into the kidneys. Now, one of the things that is going to happen to these kidneys when you have those high blood pressures is that at some point they're going to fail, because there is a lot of workload that the kidneys are being subjected to over a period of time. So it may actually happen that they actually fail, and this could be just progressive over a period of time when you talk about chronic renal disease or chronic kidney failure, or could actually be acute over a short period of time that you actually have what you call acute heart failure.
Yes.
And we see these things. We have had our viewers, some of them have had some of our relatives or some of our loved ones who require something we call dialysis.
Yes.
And this dialysis comes as a result of kidney insufficiency, kidney damage, some of it which is very acute or all of a sudden, some of it which is over a long period of time. So kidney disease can actually occur. Now, what can we do? Of course, the mechanisms are a bit complex, but
that's the most important. What do we do?
What do we do to be able to avoid these particular complications? One, that I just talked about, earlier on about the treatment and how we should have follow-up in terms of the clinics, follow-ups in terms of the reviews by the doctor, because at some point we need to adjust the medication. So one issue is about clinic follow-up so that we can give the health provider an opportunity to be able to review the treatment that the patient is actually on, so that we can be able to say these drugs are controlling your blood pressure optimally, we need to sustain on that. This one is not enough, we need to add on this dosage for this particular drug, or we need to introduce another drug. This is over medication, we need to adjust. So the regular scheduled follow-up is going to be very important. Now, number two thing that we're also going to help us in terms of preventing the kidney disease or kidney complication is, we talked earlier on about substance. In terms of cigarette smoking, tobacco and alcohol. These substances have what you call a synergistic effect in terms of causing the complication to occur. Something like alcohol, excessive alcohol intake will actually cause the liver to break down the drugs or the medication very fast, that they're actually not even enough to be able to control the blood pressure. So that particular person needs very high doses. So in terms of checking on our lifestyle, in terms of the substance that we take, we need to be very keen about that and to avoid, well, medical language, you never say. So
someone might be taking their medication, but they're uncontrolled.
They are uncontrolled because
the metabolism has changed because of these other substances.
Because of these other substances that are actually coming in. So issues to do with the substance abuse, issues to do with alcohol intake and all these things, we need just to be very thorough and very deliberate in terms of how we basically approach them. Of course, the other issues in terms of preventing this, would say, is that once you realize there is any abnormality in terms of the function, in terms of the urine output, because sometimes the patient is able to tell that now they are beginning to have very minimal urine output in a couple of days or in a couple of hours, and it has been somehow progressive, so there is a problem that is setting in. It's important for us to be able to seek medical advice earlier. Sometimes it is on the other way around, that you're actually having excessive urination and urine output, because these are symptoms that tells you something is not working.
Is not maybe able to filter
exactly
very well.
It's not able to filter very well, and we need to do something about it. There's something needs to be done in terms of medication, in terms of tests, in terms of other adjunct or supportive therapies or treatments needs to come in terms
maybe
of this.
To just bring you back, we had mentioned that we have risk factors, and I think maybe you may remember some of the risk factors. What are some of the ones that can be modified? Because we know, like, for age is not modifiable. You're going to grow. We're all going to grow old. There's nothing we can do about that. But what are some of the modifiable risk factors that we can at least halt, so that we prevent the development of either the complications or the development of hypertension?
Thank you. Modifiable risk factors most likely relate with the lifestyle. And this involves one, for example, in alcohol intake. That one should be literally avoided. And probably one need to not to take alcohol. Also smoking.
Yeah.
That lifestyle smoking, we were told that it's one of the risk factors to
Yes.
hypertension.
Yeah.
And that ought to be really stopped when it comes to controlling of hypertension. The other things about life, that is the general lifestyle, that we call it sedentary lifestyle. This is when it comes to being involved physically. We need to do physical exercises. We need to do to take responsibility on that area. In a nutshell, the things that are modifiable are at the responsibility of the patient.
Yeah.
It's purely responsible of the patient to take care of that.
Yes.
Just to mention on the diet.
Yes.
When it comes to diet, like in the previous program, we talked about diabetes association with added sugar intake.
Yeah.
Here, I want to just mention about hypertension and the diet. As I think we mentioned earlier, just to emphasize that the added salts, as we said earlier, it's a risk to hypertension. And in our setup, that is a problem we have to deal with, because many people usually just add salt and just take it without even tasting food, as earlier mentioned. So these are the things that are responsibility purely lying on the patient's hands to deal with.
Yes. Yeah, maybe on the issue of salt, I would just want to add something about the different salts that are there in the market. We do have salts like the Himalayan salt. So when you compare the kind of salt that we have, the iodized salt, it's usually about 97% of sodium chloride. But if you use the Himalayan salt, which is a salt from the Himalayas, and it's a bit more expensive in the market, but it has 70% of sodium chloride. So if someone can even switch to using that kind of salt, then they'll also reduce their risk of getting hypertension, because we've said 5 grams of salt in a day, but at least if you also use 5 grams of salt that has less sodium, then even the risk of hypertension is going to reduce. So I'll just mention something about the DASH diet. And this means, DASH diet means a dietary approach to stop hypertension. So as you said, diet is very important to our viewers, yeah? So in terms of the DASH diet, we are trying to reduce the amount of fat that you're taking. So if you're using foods that are fatty, you're going to look for, if it's dairy products, you're going to be looking for low-fat dairy products. And then salt, we said a normal adult takes about 5 grams of salt. But with the DASH diet, you're trying to restrict the salt intake to about 3 grams of salt in a day. So as 5 grams is a tablespoon, that means you're going to be using about 3/4 a tablespoon of salt. And then you'll avoid the tobacco, you'll avoid the alcohol, and then you'll increase the amount of vegetables that you're taking in and increase the amount of fruits. So we can still stick to what we mentioned last week about diabetes, where your plate is going to be, half of it is going to be vegetables, a quarter is going to be starch, and a quarter is going to be the protein. So going back to our discussion, we've looked at some of the complications. Yeah, so maybe I'd like you to just highlight any experiences. I think you've been working, you've been in public health, and you've worked with patients who have chronic hypertension. What's the most important thing you'd want to tell Kenyans about it? Yeah?
Right.
From what you've seen and do, anecdotal experience.
To our viewers, one of the most important thing about hypertension is one of the chronic diseases and non-communicable disease that we did talk about, is that it's important to understand what this disease, number one, what this disease is all about. Because the understanding brings a lot of compliance and a lot of adherence. And I think that's our part as health providers, to be able to make sure that patients do understand and individuals do understand what exactly is this particular disease. Having said that, number two thing is we need to look at it not from a negative perspective, now that the diagnosis has been made, but from a very positive approach, that it is possible really to control this particular disease. I've encountered very good success stories, of people who have been diagnosed with hypertension and who have been on who have been on follow-up, and they have had their pressure score or their blood pressure controlled, and they have had minimal or very few complications, as it were. On the other side, we've also encountered the flip side of the whole story, whereby things are just happening the wrong way, and it's really devastating. So what you're saying is, let us have compliance. Let's be compliant with clinic follow-ups. Let's be compliant with our treatment. Let's be compliant with the doctor's advice. Let's make sure that we are participating. We say this multidisciplinarily. It's something that all of us have to participate, and by the end of the day, we are going to be able to see success and minimal complications, and the global burden is going to reduce, and are going to contribute to a healthy nation and a healthy economy.
Yeah.
Thank you.
Sami, maybe you could give your parting shot to our viewers.
Thank you, Daktari. To our viewers, it's great for that discussion. We've learned a lot, and the truth is, hypertension is a disease that is manageable. Let's take a responsibility of our health so that we can have a healthy nation, and also at a personal level, we may have a healthy mind in a healthy body. God bless.
Thank you, viewers, for keeping on watching about hypertension. So what we'll say is, I wanted to leave you with a verse. We know that it's a chronic condition and it can be managed. But from the book of Ezekiel chapter 37 verse 2 says, "And he caused me to pass by them round about, and behold, there were very many in the open valley, and lo, they were very dry. And he said unto me, Son of man, can these bones live? And he answered, O Lord, you know. Again he said unto me, Prophesy over the bones, and say unto them, O you dry bones, hear the word of Jehovah. So thus saith the Lord Jehovah unto these bones, Behold, I will cause breath to enter into you, and you shall live. So even in as much as one may have this diagnosis of a chronic condition, the Lord's word to you is that the dry bones can live again. So we want you to keep on watching our show, to keep on learning. We'll see you next time. Thank you for staying on.